Desde Madrid les envío un cariñoso saludo a todos los colegas que nos están siguiendo desde Latinoamérica, Estados Unidos, África y aquí en Europa. Para mí es un gran placer y honor darles la bienvenida a nuestro primer Día Mundial del Pulmón Crítico, una iniciativa de la Federación Panamericana e Ibérica de Medicina Crítica y Terapia Intensiva. Es una gran oportunidad para compartir con más de 3.000 colegas un programa interesante y muy completo de las principales patologías respiratorias que hacemos frente a diario en las unidades de críticos. Desde 1950, en la epidemia de polio, base de nuestras modernas UCIs, hemos avanzado mucho en el conocimiento y manejo de la patología respiratoria crítica. Asimismo, en los últimos años, los cuidados intensivos están viviendo una revolución impulsada o promovida básicamente por la presencia del médico intensivista, ese especialista capacitado y dedicado en exclusiva a dar el mejor soporte al paciente crítico. Yo, que llevo muchos años en esta especialidad, he sido testigo cómo los cuidados intensivos se han transformado en una parte indispensable de la estructura de vida hospitalaria,
main part of an essential part of the hospital structures, improving day after day thanks to the collaboration with other specialties. And I have also been a witness of how these days the training has been changing, so that training is done increasingly through online communities promoting interactive learning, such as webinar applications, online courses, guidelines, etc. We know the impact that respiratory diseases have on health, and they are still among the main death causes for death in the world. Next to 65 million people have COPD, and 3 million per year die out of this disease. The infections of the lower airways are responsible for the death of millions of people every year, and it is the main mortality cause in the children under 5 years of age. As for tuberculosis, every year more than 100 million patients develop this disease, and still 1.4 million people die every year, making it the most lethal infectious disease. And in a more specific way, the adults' respiratory distress syndrome constitute 10% of the stays in the ICUs, and in 75% of the cases, the risk factor provoking it is pneumonia or a sepsis of a non-respiratory origin. Pneumonia associated to mechanical ventilation, with a prevalence from 9 to 27% and mortality around 10%, and with an expense of between $10,000 and $40,000 per case. Thus, the World Day of the Critical Lung is important so as to make a call on the professionals of medicine, governors and politicians as well, on a group of pathologies that affect the most vital and the most vulnerable organ that we have. And therefore, one of our main goals should be to keep advancing on the efforts to offer the best attention and the best support to those patients suffering from a very serious pathology. Today's program is very wide and very attractive. 7 sessions, lung and critical conditions, monitorization and ventilatory support, lung infections, the adult distress syndrome, the COPD, and the respiratory pathology in the patient that is immunocompromised. Professor Jean-Luc Densen will finish this session. He will speak about the evolution of ARDS during the last 50 years. I want to thank the organizers, especially the organizing committee, for the dedication and the effort to make this project a reality. I want to also thank all the speakers and all the scientific institutions that support this initiative, and very especially the Pan American and Iberian Federation for Intensive and Critical Therapies, and Dr. Ugarte also for their support and help. I also want to thank the CIMED Foundation of Colombia and the Doctors Belda and Julio Villanueva of the hospital, the University Hospital San Chinarro. And I want to also thank all our sponsors, Draeger, Menarini, GSK, Pfizer, and other sponsors, Distribuna Publishing House, and also thanks to all the colleagues that have enrolled in this activity from all the countries of the world. You can see on the slide the countries that are taking part, and I'm going to give the floor to Dr. Tiago Lisboa from Brazil, who is going to moderate the first session, the lung under extreme conditions. Thank you to all of you.